I've noticed today there's a lot of people walking around with iPads, there's iPhones out there, Blackberries, and that just demonstrates that technology has become quite pervasive. And I think we're going to see a lot more of that as we go along, because we won't be able to cope doing things the way that we always were. So looking back to the last few speakers, looking back at history, it shows that nothing stays the same, and technology is actually foisting us further and further forward. So I thought I'd firstly introduce where the Grampians region is in Victoria. So of course it's in the fair state of Victoria, and it covers, the region covers approximately 50,000 square kilometres in the western part of Victoria. You'd have to say that it's not sparsely populated like Queensland, so we don't have lots of really truly remote towns, and so I think there's only one town regarded as remote in all of Victoria. So we have a lot of rural and regional locations, and a lot of those locations are populated somewhere between 5,000 and 10,000 people. In my particular region, we've got Ballarat, which is almost 100,000 people. We've also got Horsham, which is roughly 20,000 people, and then we've got a broad spread really of other towns. But we experience all of the problems that you see when you're dealing with rural and regional, and some of those were detailed earlier. So in my region, we've got about 40 public health services. We've got some community health centres and services in that area. We've got bush nursing centres, and these generally are focused mainly on aged care and a lot of personal care and home help services. The services that I provide are around, and my team provide, are around ICT. So we provide the communication links, the phones, all of the IT. And so there's roughly 160 network connections ranging across all of the different technologies, and mainly brought to us by the Big T, Big Telstra. We've also got other customers which are across local government, so we've got some councils on our network. We also have, lucky enough to have some community services, which helps to bridge some of the gaps between our tertiary institutions, secondary institutions, and of course our community services and NGO sectors. So we've got, across health, we've got about 7,000 staff in the health services across the region. It serves the entire care continuum, so everything from acute emergency care right through to aged care, rehabilitation, mental health. They're all served right across the region by our health services. We've got lots of aged care. That's a feature, I guess, of our region, is that we've probably got more aged care beds than any other region within Victoria. We have significant linkages with education, partly because of University of Ballarat, but also because of other links around particularly medical schools. So we've now got the Deakin Medical School sitting in the Ballarat Health Services. About 750 million in gross operating revenue, so it's a big operation to run health, and particularly in that region. Ballarat Health Services is the largest part of the region, and they're 350 million by themselves. So their needs tend to dwarf the needs of the region, which is a little bit like servicing the elephant and the ant. So I wouldn't say that there's huge differences necessarily in the types of care that's provided. So the quality of care is still high. We still have doctors, we've still got nurses, we've still got the appropriate care. What we lack is specialist care. So that specialist care tends to come from Melbourne, and usually people jumping in cars and travelling around the region. That is becoming more and more unsustainable. There are significant impacts to delivering care in a rural area. Distance, of course, you're talking about 50,000 square kilometres across the region. So distance between campuses of hospitals and also between the health services themselves that might provide some specialist care in one centre and generalist care in another, that causes all sorts of problems. Putting people in cars is an expensive thing to do. Choice. Not everyone has the same choices out there as well, because those services might be a couple of 100 kilometres away. Telecommunications, there's usually only one provider in telecommunications, and if you're lucky enough to get a telecommunications link at all. Staff. Our biggest challenge is actually retention of staff, not necessarily attraction. They tend to come, we train them, and then they leave. So that's a bit of a problem for us, and that's probably no different to any other rural area in Australia. Diversity. We've got a diverse community, not as diverse as, say, the western suburbs of Melbourne, but they are still quite diverse. And what's happening now is there's a shift of people away from the smaller towns into the larger centres. Now, what that's causing is significant dislocation for families, and unemployment as well. And so what we're seeing as a result of that is we're getting our services to cluster together. And so we end up with disciplines collaborating together, and often I call it, wearing the underpants on the outside, that this person becomes, the health service operator becomes Superman. They have to do everything, and they do it after hours, and they do it on call, and it's very, very difficult out there to do that. So the role of hospitals is definitely changing, and it must change. We need increasing integration across our care delivery systems. Now that's everything from our training environments right through to the service delivery itself, and that's across what we might call the care continuum, but it's really about shifting the way that we deliver the services, particularly making it closer to home and hopefully delivering it to the home. So why do we need a change? By 2030, the 65 to 84-year-old group will double, and over 85s will quadruple. So a lot of the impacts that we're seeing in our emergency departments in metropolitan areas and in our larger centres in our region is because of the ageing population. That people are getting older, they're getting a disability, so they're getting sick effectively because of ageing. It's actually a natural thing. And I guess the question that I'll be asking at some point soon to Fiona will be, how does health fit in the NDIS? Because in fact a lot of disability occurs as you grow older. The need for residential aged care places is going to double by 2030. Now there's two ways that we can handle that. We can handle it by having more home-based care, or we can handle it by putting people in the most appropriate setting. And I think that's important to realise that not always is the home the most appropriate setting. Diabetes costs are going to significantly go up. We're already seeing that in, I guess, well, at the moment it's the 35 to 55-year-old age group at the moment. We're seeing that shift. 1 in 5 people in Australia currently have a disability, and that's going to go gangbusters because of dementia and Alzheimer's. 9% of admissions are avoidable. At least the Australian Institute of Health and Welfare are saying that they are currently avoidable because of medication mistakes. They're also avoidable because of inappropriate setting. And that comes at a massive cost of $2.3 billion currently. That's today's dollars, not future dollars. So our clinical groups within our region asked 4 specific questions. How can technology help us to work smarter, to influence this? How can we more effectively support staff across these large areas? How can we maintain and extend our staff skills? And how can we impact the ageing demand equation? Because ultimately, that is the issue. It's as we age, there's going to be greater demand on our health system and on the community services sector and on all parts, whether it's education, economics. The economics of it are very clear as well. So in our region, we did something reasonably spectacular, which was we built a wide area network. We joined up all of our community services, all of our health services across 40 towns. Now that came from a Commonwealth grant. In total, about $20 million has been spent on our region to bring us up to a particular level. Now, in some ways, I like to call it the mini NBN. It was way prior to the NBN, and it's got us to a point now where everyone in our region is connected. So it encompasses a lot of different technologies sitting on the network. So it's the network itself, the telecommunications links, it's voice over IP, which is effectively software-based telephony. So every single phone in every hospital and every non-government organisation and every health service in the region have all their phone systems run off effectively the data lines rather than running off your standard telephone lines. We have fixed and mobile clinical video conferencing. We're experimenting with all types of technologies, but we're putting it as close to where the patient is as we can. So they're located in clinical areas, they're not located stuck away in boardrooms, they are where they need to be. And we're also supplying applications to people. So if whether it's in aged care, whether it's in the hospital, we provide that in a shared environment. We're doing things in wireless these days as well, so we haven't limited it to being tethered to a particular location. It goes where the clinicians go. It goes where the workers need it. We have blended training between our universities and our health services. We also provide e-learning, so we've got e-learning portals, and we try to make sure that we're beaming into the most appropriate location for their training. So we've recently got a project happening around Health Workforce Australia in trying to bring more nurses into our health services and bring up those places. The problem has always been coverage of shifts, so having preceptorships, etc., happening right across all shifts. Get them trained in everything, not just a component of it. Make it realistic. So we're using video conferencing to do that. We're also, as an adjunct, it's not used solely, of course, and I think the key there was actually linking up all of our education institutions. So we've got SMB TAFE, which is part of the University of Ballarat, and we've also got Australian Catholic University involved as well as Deakin. So we're trying to mesh all these things together. We also have our operating theatres completely networked as well, so you can actually record things happening, an operation happening. You can beam in training from where it's UCLA in the US, or it could be somewhere in the UK or anywhere else in our region or with Australia.
Once upon a time, patients needing medical attention out where there's no local doctor either had to travel large distances or await the arrival of the fabled flying doctor service. But this is the age of the video doctor. In 40 outlying towns like Birchip, near Victoria's northwestern Mallee district, broadband is helping to overcome the tyranny of distance.
The National Broadband Network can bring in patients' homes, connect them up to hospitals, and when you do that, it's a dramatic effect.
In 2003, a few key people had the vision and foresight to propose the building of a high bandwidth converged network, linking all public health services in the Grampians region. Recently, the service has expanded to link with some major metropolitan health services in Melbourne and adult retrieval and ambulance services. This will allow for further access to specialist support to regional areas.
So, as the video says, that we've expanded the network to encompass access now to metropolitan health services, and that was something that we needed to overcome that, because it's great to have us at a particular level, but everyone else needs to be at that same level, and access to the metros was clearly something that was lacking. So, innovation and service delivery improvements in healthcare today and towards 2020 will be driven by the need to apply new models of care to an ever-increasing demand, and it should bring advances in prevention practices, rapid diagnosis, earlier intervention in acute settings, a move towards bringing care in the most appropriate setting. And in many cases, that's probably the home. Accurate intervention due to enhanced decision support, so hopefully we'll have information being available to people so that it helps them with decision making, rather than having to chase it and spend hours and hours on the phone and literally doing the legwork. We'll hopefully also have easily accessible information from all health providers and community service providers around the health status of the individual, and appropriate research being conducted to further our human endeavours to extend our own lives. And of course, technology in 2020 in Australia will be marked by pervasive access to communications technologies, in part to this national broadband network, and because technology itself is becoming pervasive in our home and work lives. There are significant drivers underway to adoption of ICT, and we see it daily in healthcare, in the healthcare environment. Technology has also become the norm for many in our communities. It's already showing signs of influencing the way people interact with their health and community service providers. It's apparent in the Generation X's, the Y's, and the way in which patients are communicated with by their health and community services. Email, Twitter, Facebook, these are some means at the moment by which people are communicating. Veterans are very much sought after by private health and public health, whilst baby boomers are encouraged to be part of electronic chronic disease management programs. And this is largely happening by the health insurers. And you'll probably see very soon that Bupa and Medibank Private are about to launch their campaigns around attraction of to people into their chronic disease programs, which is, effectively you'll be paying a premium, but ultimately it hopefully will, it'll save them money, but it'll also save the person insured a lot of time as well. And I think just watch for the ads. They'll be blasted all over your televisions. The world in which we live is becoming a lot more connected, and we expect our health and community services to be connected inside and out. The wired and wireless world is now upon us. And it's not just about speed. The NBN should be seen as an enabler to establish new connections between metropolitan and rural communities, and allowing for equity of access to services we've come to expect from our service systems. Today, this equity of service is being challenged, and we are seeing differential level of service given to those that can or cannot afford it. For example, within major cities, it is possible to receive home-based care supported by remote monitoring. And these technologies are available largely from private nursing agencies. And these get reimbursed through private health insurance schemes. The public system currently do not provide this technology-supported home-based care, partly due to the way it's funded, but also because the public system needs to be able to provide equitable access across metropolitan and rural and regional locations. There may not be good telecommunication services in a rural or regional location. It's for that reason that 100% of households, hospitals and community services need to be on the NBN. Now, this is going to take some time. Just 2 days ago, some further sites were named under the NBN, and those further sites, luckily for me and for my region, included Ballarat and Melbourne City. So that probably means that we'll be able to connect my region up. But what does that mean for everyone else in Victoria? It means they're going to have to wait. And that's not a good thing, but we do have to provide equity of access. So if speed and access is a non-issue with the NBN, e-health initiatives should also take off. So electronic health records and other telehealth initiatives will also take off. For those that's interested, I also did a bit of a video for the NBN. It looks like I've rather aged somewhat. So that's just a bit of a screen grab of the website, so feel free to have a look at nbn.gov.au, and it's under the health and aged care area. A colleague of mine, Professor John Wilson, also talks about cystic fibrosis and his patients and how they're accessing his specialist services from the Alfred, but accessing it from their rural locations. So with the Commonwealth's investment in the NBN, regions have the opportunity to consider what may be possible to support the transformation that we need. The examples usually given for transformation driven by advances in ICT are usually banking, airlines and hotels. In health and community services, it's likely that successful initiatives exist internationally and across other sectors. These should be researched, and companies should partner with willing providers. We shouldn't be scared of these companies. I believe that Grampians Rural Health Alliance is a very successful example of such a partnership. We have quite a few partners, but they're mainly the networking partners and some of the big, I guess, the big guns of both telecommunications and IT, and that's really helped us. Although the NBN will tether us to our homes and businesses, being mobile is the new way of working. It will be important for health and community services to look at how services can interconnect by putting the person at the centre of communications. For this to happen, choice of technology should be theirs and not foisted upon them. It will be our jobs as IT to make sure all the technologies work together. We used to be called the No department, not the IT department, because we just couldn't cope. You weren't allowed to bring your iPads, anything with Apple on it, couldn't do it. Boy, has that changed. So mobility and support for a variety of technology platforms is key. This slide was actually taken from House a while back, but he was showing an iPhone. He probably should be showing an iPad now. Video should be used as a means of transport. So instead of using the car, it now should be video. We should have ubiquitous access that's not dependent on the device. One size really should fit all. You should be able to choose, and it just works. Bring your own device, in other words. And joining up all networks, whether it's universities, community services, or others. And of course, once you've got the network and it's all interconnected, and we've got the momentum from the rollout of the NBN, then we start to look at how we can support the population as they age, and they age in the most appropriate setting. This is where assistive technologies come in, being able to provide support for people using technology rather than through direct human intervention or reliance on a carer for every task. Sometimes the most simple can be the most effective. For example, self-management in home settings with potential savings and other personal benefits. Home automation, which will enhance security, safety, independence at home, and will help maintain quality of life and decrease the demand for carer support hours. The communication technologies will provide important benefits for people whose mobility is limited or who live alone. Information systems and technology to improve service delivery and infrastructure and processes at the back end as well will benefit. So examples of some assisted technologies, falls detectors, detectors for the front door so that the person knows when someone's approaching. They can press a button and it'll open their door. Clocks with large faces, really simple things. I mean, we take these things for granted these days, and we've miniaturised everything. We need to blow them back up for the aged population. Things like movement sensors, so knowing when someone's moved from room to room. So if someone's, you might have an elderly mother or father and they've moved into they're a smaller place. If you can know that they've spent, 4 hours in the bathroom, they've probably had a fall. So it's something that these technologies will really help us to actually get there and intervene earlier, and hopefully even prevent things from happening. Sony's iBo robot has been used as a way of monitoring what's happening. So you put a little sensor, a little camera on the robot, and it can roam around and show you what's happening in the room. And of course alarm systems as well. There are challenges for consumers in all of this. Attitude. Older people, when faced with new technologies, can find themselves in a difficult, vulnerable position. Income, location, health, disability, experience, they're all going to be influences. And the complexity of technology may be overwhelming, the equipment difficult to access, and there might not be the appropriate support because, again, they need a lot of companies to manage a lot of this as well. And, simple things. Things are in small print. We need to blow them up again. And that's going to lead to smart homes. So we'll have things like sleep monitoring happening. We'll have falls prevention monitors that are weaved into garments. They already exist today. Vital signs monitoring remotely, mobile telemetry, So we can focus on activities of daily living, physical activity and fall detection. Temperature and humidity sensors. So if you've, as an example, MS, they notice changes in temperature a lot. So being able to manage that wherever the person is quite useful. Talking about telehealth, where does telehealth fit in all of this? Telehealth initiatives, or rather video conferencing, have been in place in public health for some time. Its implementation has been patchy and not interconnected well with others. Although we've done it in Grampians, a lot of private providers haven't picked it up, so GPs, specialists, others haven't picked it up. The Commonwealth announced telehealth initiatives. There's about, I think it's about 500 million available for telehealth incentives for GPs and specialists. But of course you've got to have the equipment, you've got to have the support, and you've got to have all the connections and the network. So we've done that, but others need to do it as well. So we're launching a bit of a campaign around getting people to become telehealth capable. What does it take to do what we've done? And why do we need home telecare? Why is it important inside the home? Is that it can reduce institutional care by 2/3. Now imagine that. All of a sudden the demand equation shifts. The impact to Australia is around 130,000 people impacted immediately if we were to do something around home telecare. $6 billion in saving annually. We can reduce hospital admissions by 20%, bed days by 25%, and readmissions by 25%. And these are from studies extrapolated from the UK, where this has been implemented quite heavily. Just to show you what they look like, that's an example of a current unit out there. So you've got thermometers, you've got all sorts of technologies associated with it that people are using as individual things today. And they use it usually by going to a doctor, or a nurse might come to them. This basically has got a web camera. It can be supervised basically remotely. So we're going to see a shift in the way that that's provided as well. But we also need a scaled down device, something really simple. You might have diabetes, you might need some basic things, you might have a heart problem, so these can be scaled down as well. And why wouldn't you do it? And there's some quotes here that the cost of one set-top box is the equivalent of the cost of 1 hour of care per week. So once we get the technology right, once we've got the communications in place, we can really start to shift things. But there are also challenges as well, that you can put things in the wrong place, you can do things the wrong way. So there will be pitfalls as we go along as well. But imagine being able to talk to your doctor, specialist or allied healthcare provider from your home about your healthcare requirements rather than having to drive hours to meet them. If you're in a rural area, that's really important. Imagine all of the healthcare providers being able to work effectively together using technology to share data, records and advice, which improves your experience of the health system. Getting the information you need when and where you and your family members need it. Imagine being able to keep your own health records to share with all the healthcare providers you contact instead of having to verbally repeat the story over and over again. Imagine not having to repeat pathology tests. Every time you go to a doctor, you get another test. And ultimately, we've gone filmless in radiology, and as soon as we shift to video, there'll be other improvements as well. So the key messages are that there's been much achieved due to investment in broadband in our region. The NBN will also do that for others. However, that's going to take some time. All rural regions need to be at the same high level to achieve benefits. Layering new applications on our network has proven that makes a big difference. And linking metropolitan health providers into a region is probably the key to it all. I think we need to really focus on aged care and home, and I think that's why fibre to the home is really, really important, not just to the street, not just to a business, all the way. Funding models need to shift dramatically to keep up with this. It's happening today, and so far what we've seen is the telehealth initiatives being funded. They need to go further. New technologies in the home need to be linked in to the health service itself, and remote monitoring, smart homes and home automation will also make a big difference. Thank you very much.
Bye.